We're going to start up with the second part of our program. The title is Long-Term Care and Medicare.gov Part D Plan Finder. The Finder is a very useful tool, and long-term care is a really important subject. So we'll go ahead and turn that over to Marcelo, and go ahead.
Yeah, hi. I'm just going to take a few minutes to go through the Medicare.gov Plan Finder. Of course, it's always asking if you want to get updates and information. If you're comfortable with this, is to create an account with Medicare.gov. And in this way, you can see claims information. You can see a history of the drugs that you've filled through your Part D plan. If you don't have an account, however, you can still look at health plans and drug plans. So let's click here, preview health and drug plans. Just to show you, though, there are other really useful things. You can find providers. And this is another way to find plans. Then to find help, preview 2022. Again, you can log in or create an account, but since you don't have one, we'll go with continue without logging in. Again, you'll see this log in, see without logging in. Got to answer a couple.
Once you get past that first part, we're going to select drug plan. Now, you also have to scroll down to get to the next question. It's not visible. So you scroll down and then enter a zip code. So I'll go ahead and enter our office zip code, 95054. We're in Santa Clara County and Santa Clara. And then you have to scroll down again because the questions flow downward. Here, do you get help with your costs from one of these programs? Again, to try to help provide accurate drug cost information, which would be different if you had Medicaid or a savings program like I mentioned, or extra help. You could say, I'm not sure, or I don't get help. So I'll just say, these are the same. I'm not sure, I don't get help. So I'll just say, I'm not sure. And then I'll continue without logging in. And let's say, yes, we want to see drug costs when you compare plans. So we'll say yes. Again, scroll down a bit to hit the next button. And then let's start adding prescription drug plans. Now you'll notice, since we're in the annual enrollment period, they're setting us up to look at 2022 plans. Let's say you're new to Medicare and you still need a plan for October, November, and December of 2021. We can toggle now to 2021 plans. But let's look at 2022 plans. It will show us the estimates for the entire year, not just a few months. So I'm going to add a couple drugs. And as I start typing, you'll see that the medications will start popping up. So I'll just type one, Sinopril. There it is. Other L's, I's pop up too, but we'll just choose this. Just be careful that you enter the right medication. There's also something called hydrochlorothiazide, lisinopril. So check your actual prescription on the bottle to find that out. Once you select it, you have to add it to the list. So I'll add the drug. And then there's a default dosage, quantity, and frequency. So I can change the dosage. Sometimes this will help you figure out if this is the right medication. If, let's say, you were taking a dosage of 1 microgram, maybe it's a different type of lisinopril, or maybe there's an extended release one. So just be careful of that. You can change the quantity by month. And we have these different options. So I'll stick with the standard, and then you have to click add to my drug list. And there it is. There's the first medication. Let's say we want to add another drug. So we could click add another drug, or we could just say done, but I will add another drug. Let's say maybe torvastatin. Statin drug, add drug, and again, you can change the frequency and dosage. So I'll say every month. And you can also provide feedback. I'll say no thanks. You can also provide feedback here by clicking the feedback button. If you're having a problem with something or just doesn't seem right. But let me just close this. So I'll add this to my drug list. Now I have 2 medications, and I'll say I'm done adding drugs now. At this point, you can add a pharmacy. So they've really improved this section because the pharmacy you select will greatly impact the cost that shows up at the end, because health plan or drug plans and contract with certain pharmacies, you want to find the right combination with your list of drugs. That's sort of the puzzle that we're trying to unlock. So before we could only add, I think it was 2 pharmacies, and then it became 3. Now it's 5 because it just helps us cast a wider net. So they have a nice map feature now where you can, based on your zip code or address, search for pharmacies within a certain mile distance. So in fact, let's put our actual address in. Okay, so that is our office location, and it's finding pharmacies within 5 miles of us. Let me see if there's anything closer. Okay. Apply. Okay. So we're in a very industrial area, so there's really nothing within a mile. So let me change it to 5 miles and hit apply. Okay, now we have some pharmacies. There's Costco, and you can see on the map, as you click, the pharmacy will show up. Safeway, Kaiser has a pharmacy. And I'll just add CVS. And if you want, you can also select mail order at the very top. So I've selected 3 pharmacies and mail order. So I'll click done. And now, based on those 2 medications, the several pharmacies that I picked, it will find the plan with the lowest drug and premium cost for 2022 when you add it all together. So that way we're comparing apples to apples. So based on my location, SilverScript Smart RX will have the lowest annual drug and premium cost. So it shows me the premium, multiply that by 12 and add it to all the drug costs. And it comes out to $114 per year at one of the pharmacies I selected. I don't know which one yet, so I'm gonna have to view the details to see. This plan also has a pharmacy benefit. So if you filled all those prescriptions through the mail, through SilverScript's mail order pharmacy, there's no difference. There is a drug deductible of $480. So some of your drugs may require you to pay full price before the copays kick in. And so I can compare this with the other 3 plans. I click on Add to Compare. WellCare is the next one, and it's $130 per year at one of those pharmacies. So let's say I'm going to compare that. Plan details, if I already know I want to delve into that, but I can compare 3 different plans. And you see that there's sort of a big jump. I only picked 2 drugs, but look, from $130 up to $216 already. So I'm going to compare that. Now, just to show you, it matters what drug plan you're in. It's just 2 drugs. You go to the very bottom of this list, and this is not the very, very bottom. Let's go to the very end. You will see that some plans for those 2 drugs the cost could be thousands of dollars. $1,200. Most expensive one is $1,900 in this plan. And mainly it's the premium that's causing the big difference. So it really depends on the list of drugs and the pharmacies you pick and the premium. So I'm going to compare these 3, the top 3. And when I do that, you'll see side by side, it will show you the premium amounts. Again, you don't want to pick based on premium, but in this case, it happens to be true that it provides the lowest cost. As you scroll down the details, cost isn't the only factor, but there are restrictions that may apply. And this is a very important thing to look at. So if I were to look at the restrictions of this SilverScript plan, it takes me to what's called the drug coverage section for that plan. It tells me what the pharmacy is, if it's preferred or not. I have to scroll down a little more to show you atorvastatin and lisinopril. But further down will be the restrictions. Let me get down here. Fortunately, you have to go all the way down to look at drug coverage, go down further. And here's where the restrictions lie. It's a little bit buried, but it's important. These are the 3 types of restrictions that a plan has. Prior authorization, where your doctor or your prescriber has to tell the plan, yes, he needs this or she needs this medication. The quantity limit. So atorvastatin has a limit. And as we hover over this or click this, it will tell us that you can only get 30 days every 30 days. And then step therapy I mentioned earlier, where even though you're prescribed a medication, you're going to be required to take a lower cost but equally effective, proven effective medication. Unless it doesn't work for you, then you can always appeal all of these restrictions, but with the help of your prescriber. So navigating it takes some time to get used to, but you can always go back to the top and even further up to go back to the plan comparison. So let's go back to the plan comparison. Now let's say I'm going to look at SilverScript. Probably not going to choose ClearSpring. It's only got 2 stars. You can look at what gave it 2 stars. But scrolling down here will reveal at which pharmacy I will have the lowest cost. So here in this plan, you go to Safeway, Costco, or CVS, you're going to pay the same amount, $114. So you have some flexibility in where you can go with this plan. If you try to fill your medications at a Kaiser pharmacy under this plan, of course, Kaiser pharmacies aren't part of the network. So that's the cost of those 2 drugs at a Kaiser pharmacy. You'd want to be a Kaiser member to get better pricing through Kaiser, of course. So that's just a quick example of how to use this plan finder. I'll keep going back here. I just want to show you Now, let's say you're not with Original Medicare and you want to look at Medicare Advantage plans. The way to switch is up here. So instead of having to type in all your medications, you can view the drug pricing in these Medicare Advantage plans. So I'll click on that. And now it shows the drugs, the plans with the lowest cost drug and premium cost. And in this case, Scan has no premium plan, and the drug costs are there's no drug cost in this plan. We can look at the plan details here, and we can look at drug coverage. So if we're just focusing on drug costs, and here you'll see that as atorvastatin and lisinopril would not cost anything under this particular plan at those 3 pharmacies or mail order. So again, it really varies. This is the best tool to help you find it. Now, keep in mind, plans can change their rates throughout the year. It's a combination of FDA information, but there's some appeal rights for some drugs, but in specialty drugs, if they're over a certain threshold, you can't really appeal the pricing. So once you're in a plan, you're in it for the rest of the year unless something happens. Like let's say to your Medicare Advantage plan, but pretty much you're locked in for the rest of the year. Okay, so that was a quick demonstration of the Medicare Plan Finder, and we'll be using this a lot in the next few months. So, are there any questions then?
Yeah, we certainly have a few questions, Marcelo. Thanks for going through that Plan Finder demo. And yes, as a reminder, yeah, we'd encourage all to, review their Part D, excuse me, let me just close this window. We do encourage all to review annually, especially for those that have, standalone Part D drug plan via the Original Medicare route and even the Medicare Advantage route, because every year we are allowed to review our coverage and change during the upcoming annual enrollment period, which is October 15 through December 7. So we encourage everybody to exercise that right, because every year folks can save money just by doing a simple check. But to go through some of these questions, Marcelo, someone asked, and I think it was right before you were talking about step therapy and kind of what it is, but maybe we can clarify once again, what is step therapy? What do we mean by that when for a Medicare Advantage?
Okay, yeah, step therapy is a restriction by your drug plan, whether it's a standalone Part D plan or your drug plan through your Medicare Advantage plan, wherein the plan will require the member to have a lower cost medication that has been proven as effective as the higher cost medication. You can only move up to the higher cost medication if, with the help of your doctor, show that the lower cost medication can't be handled by you. Maybe there's some adverse side effects and they're documented. So the doctor would have to convince the plan that you can't take that lower cost medication, and then the plan would have to approve the higher cost medication. So sort of taking it step by step. So that is what step therapy is about.
Thank you, sir. Hey, and there's another question after that one. Maybe if you don't mind, Marcelo, or if you don't mind, you can pop open the chat and read it.
Yeah.
Maybe easier for you to just read it, because I understand what they're asking. And I know once you read it, you'll understand and answer appropriately. It's from Stephen Simon. Great question, by the way, Stephen.
Okay, when you become eligible to apply to Medicare, is it one step? Is information saved across all platforms and plans, or do you have to apply for each part? I'm with Kaiser, so I imagine one application would enroll me in all the necessary components, right? So, so there are steps involved. Let's just talk about the end goal being Kaiser Senior Advantage Medicare Part C. To effectuate that, you've got to start at Social Security, sign up for A and B. That's the first step. Then you can, because you have A and B, sign up for Kaiser Senior Advantage, and Kaiser Senior Advantage Part C plan includes the drug coverage in it. So, so that's that. Kaiser will keep, all of your health records, etc. Medicare.gov, if you sign up for that, it's not mandatory, but the Medicare.gov account is not mandatory, but it will populate with Medicare information, claims, and prescription drugs that have been filled by, in this case, say your Kaiser plan. And you can see that information on Medicare.gov with an account, or you could go to your Kaiser account to view other Kaiser tracked information. I hope that helps answer that question. Shall I go down the list here then, Stephen? I'm looking at the chat.
Yes, please. Thank you.
Okay, so if the local chain pharmacy, such as CVS, is in plan, would all of the US CVS pharmacies be included? There are, differences in copays. Generally, people in Northern California have the same plans, and but I don't know what the copays. I don't think that you would necessarily that other CVSs in other states would fall under the network. I have to double check, but the best thing is just to check with the plan, but because it's mainly county based. Medicare Advantage plan contracts are very county based. Standalone drug plans with original Medicare, some may be national, I should say. I've seen that before. So let me get a better answer, and I'll check into that. US coverage. Okay, great question. So can you save lists of medications? So the only way you can save a list of medication, Larry, is if in a Medicare.gov account. That's where they'll be saved. If you don't have a Medicare.gov account, then you'll have to enter them every year, every time. Yeah. Does VA mean we don't need Part D? So yeah, typically if you have VA benefits and the VA drug benefit, then you don't need Part D. Keep in mind, of course, I think you need a VA physician prescription to get medication. So so there are some procedures that you need to navigate in that sense. Gail asks, if moving out of state mid-year, are we allowed to change Medicare plans if current plan is not viable in new location? Kaiser will be 2 hours away. Yes. So, so when talking about Medicare Advantage plans and you move out of that plan area, it could be out of a zip code into another county or across the country. Yes, it triggers a chance, 60 days to get into a new Medicare Advantage plan in that area. And in some states, depending on the rules, a chance to get a Medigap. The rules really depend on when you notify the plan of your move. So you can do that sometimes ahead of time, or if you've if you've already moved, you notify the plan, then it starts the special enrollment period. The VA will not fill prescriptions from non-VA doctors. Yes, thanks, Gail. It's good to know. Yeah. So I think that's it with the questions. Okay. Shall we then move on to the next part of the presentation, or should we take a break? I'm good to go either way.
Okay, go ahead to the next part on long-term care.
Okay, so long-term care. So we've touched on that just a bit, trying to delineate where Medicare leaves off and maybe long-term care begins. So what is it? When we think of long-term care, often we think of non-acute versus chronic, and that don't require a lot of skilled care. But long-term care, I mean, there's some chronic conditions like multiple sclerosis, dementia, that require a combination of maybe skilled care and not skilled. But we'll look at these various items here. Key term though in long-term care insurance anyways is activities of daily living, ADLs. They consist of bathing, getting help with bathing, dressing, eating, continence, toileting and transferring, moving from one place to the other, mobilizing. Will you need or will I need long-term care services? And it's not a clear-cut topic. And there are all sorts of products out there now. HICAPs, we go through some training for the long-term care insurance products. Beyond that, we aren't versed in these other types, but when thinking about these are the typical areas that need to be considered. Your gender, of course, because women often are the caregivers in the home and survive their husbands, which affects the strategy of planning for long-term care. Of course, marital status. So who will need the care first and who will need it second, and again, because of gender, who is more likely to pass first, and who will then need the long-term care, and how do you structure your benefits for that situation. It depends on your functional limitations. Not everybody will need or the same type of care. It depends on your health history and maybe your family history. Mental and cognitive impairments, so dementia is on the rise. They're taking up, triggering a lot of long-term care insurance benefits and claims more and more these days. And then long-term care services are also impacted by your support system. Some folks have, my mother-in-law had 6 daughters, and she used to say that was her long-term care plan. Some of us aren't in that situation, and and need to find other ways of support, whether it's through other family members, some friends, neighbors, community services. So you can't think of just one source of help. Sometimes it's a patchwork or a network of different support systems. The risk of needing long-term care services after 65. So some people may never need long-term care services. That's at 31%. And then sort of an equal smattering of needing more than 5 years, 20%, 2 to 5 is 20%. And then 17% may need a year or less, and then 12%, 1 to 2 years. We had some questions earlier about what to expect from Medicare. This may not be in the handouts we pass out, but I wanted to show you. This was kept in mainly because this was what we used to say. Hello? Yeah.
We're not seeing any slides.
Oh my, okay, I'm sorry.
Oh yeah, my fault. I'm sorry, Marcelo. I didn't know you were sharing. My fault. Thank you.
Okay, one moment.
Could you quickly go through the back slides that you went over?
Sure. I apologize. Let me get this up on the screen. Okay. Do you see this now?
There we go.
Yeah, looks good.
Sorry about that. So let me go back. I didn't go too far. These are the different sort of terms, the different factors involved in long-term care, and this is the pie chart I was referring to earlier. So, what to expect when from Medicare? Most people say, oh, it doesn't cover home care, or if it does, it's in conjunction with skilled care only. So that's with original Medicare or HMO Medicare Advantage plans. Skilled care has to be planned and in place and active for personal care services to be had. So if you're curious about personal care services in Medicare, there's what's called the policy manual. And I'll get you that link. But so to trigger personal care services, somebody that can help with activity of daily living or to help you stay at home, you have to be confined to the home. You have to be under the care of a physician or a allowed practitioner. You have to be receiving services under a plan of care and periodically reviewed by the physician or allowed practitioner. And you have to be in need of skilled nursing care on an intermittent basis, or physical therapy or speech language pathology, or have a continuing need for occupational therapy. So all those criteria are met, then and personal care services required, then Medicare may chip in. So let me share this. So here is this manual, and this is CMS regulations. Here, home health aid services. The patient must meet the qualifying criteria, as I just laid out. Must be part-time or intermittent. It must meet the definition of home health aid service of this section. Now, here's what personal care means. So again, bathing, dressing, grooming, care for hair, nail. So Medicare can do this again under certain circumstances, feeding assistance and so forth. So here's an example right out of the Medicare, guide. A physician is ordered home health aid visits to assist the patient in personal care because the patient's recovering from a stroke and continues to have significant right side weakness that causes the patient to be unable to bathe, dress, or perform hair and oral care. The plan of care established by the home health agency nurse sets forth the specific tasks with which the patient needs assistance. Home health aid visits at an appropriate frequency would be reasonable and necessary to assist in these tasks. So that's just one example. Another example. Now, the reason I'm taking the time to just look through this is because a lot of people and a lot of sites will just say there's no type of personal care under Medicare, but that's not completely true. A physician ordered 4 home health aid visits per week for personal care for a multiple sclerosis patient who's unable to perform these functions because of increasing debilitation. The home health aide gave the patient a bath twice per week and washed hair on the other 2 visits each week. Only 2 visits are reasonable and necessary since the services could have been provided in the course of 2 visits. Some important words here. Unable to perform these functions because of increasing debilitation. There's a myth that says that Medicare will only cover such things if you're improving. There's an improvement misconception. Improvement is just one standard, but Medicare is there to also help us if we aren't improving, or if what we need is to remain stable, or if we're not improving. As long as, again, it requires skilled care and all the other requirements are met. So this example assumes that all the other requirements are met, but I just want to use this fact that this person's not increasing, and yet it's still allowed in Medicare. Sorry, I'm moving so fast here, I can't keep up. Okay, so those are just 2 examples in this Medicare guide. Here's the last one. A physician ordered 7 home health aid visits per week for personal care for a bed-bound incontinent patient. All visits are reasonable and necessary because the patient has extensive personal care needs. Again, all the other criteria are met and a home health aide can visit. And if all those other conditions are met continuously, this can go on for quite some time. Okay, so let me share, we get back to PowerPoint slideshow. Okay, so options for financing long-term care. One way is Medi-Cal, so that's California's Medicaid program. This is sort of the end of the road, backstop. Once all person's other personal assets, resources are used up, not completely in some cases, but it's there from, this is the most prevalent, Medi-Cal. Prior investments that you have for long-term care. In our area, of course, home equity is sometimes looked at as part of financing, life insurance, long-term care insurance, and moving to a life care or continuing care residence. Okay, so these are just various options that people may have, and there may be even more these days. So a bit about Medicare, just a second. So Medi-Cal can help folks long-term, either in a nursing home setting, or it has what are called home and community-based services that can be had to help extend one's stay at home. Medi-Cal requires certain tests. up for eligibility, Medi-Cal, depending on the type of Medi-Cal, looks at your resources or assets, property. It also looks at monthly income as well. And then there are what are called exempt assets. So a person can have one car, one house, and those are exempt from their scrutiny. So planning and incorporating this into your strategy, if you getting help from an elder law attorney is often the way to go, because the Medi-Cal law and can be quite complicated. So there are different ways to address that, but get help from an elder law attorney. You can often find that kind of help at through a group called CANNER, California Advocates for Nursing Home Reform. And they can connect you with elder law attorneys. So just about eligibility. Again, let's look at income first. And it depends on your status, marital status. As an individual, there really is no income limit. And we're talking typically, Social Security income or pension income, whatever it is. You could have unlimited income, but of course, nursing facility care is very expensive. So practically all that income would go to the nursing facility, where the individual would then keep $35 for personal spending. When it comes to a couple, there are provisions called spousal impoverishment rules that can apply. So if one spouse needs nursing home level of care, while the community spouse doesn't, then the amounts are much higher. So for example, the community spouse can actually keep all of their income in their name. And the money from the needy spouse, or the spouse that needs the nursing home level of care, income can be shifted to that community spouse's income to raise it to $3,260 per month, with the idea of preventing impoverishment of the at-home spouse by transferring income.
Excuse me, Marcelo.
Then, yeah. Mm-hmm.
I'm sorry to jump in and bother you, but we just want to make sure that the current slide that is up is the one we're supposed to be on, the purpose of Medi-Cal, and at the moment the slide shows nursing home and home care.
Oh, okay.
We just want to make sure that's where you're at.
Sorry, okay. Yeah, so I'm looking at Medi-Cal nursing home. Oh, I see. Let me just resume sharing. Okay, sorry about that.
Thank you.
Okay, here you go. So I don't know if you saw this before, but individual, any income, you can only keep 35, but couples have higher protections. Their income can be shifted. So the person who needs the care can move some income out to the community spouse, and the lower income of the needy spouse can be compared to see if they qualify for Medi-Cal. Now, when we're looking at resources and eligibility, a single person who has resources more than 2,000 won't qualify. So they have to use all their resources down to 2,000 before Medi-Cal nursing home can kick in. Couples, again, on the other hand, can have 130,000 in the bank for the non-needy spouse. So it's much higher, again, under these spousal impoverishment protections. So some examples of resources include bank accounts, IRA, income, CDs, mutual funds, pensions you can cash. If you're drawing from retirement accounts, then the balance is not counted. Exempt resources, again, a residence, one residence, one automobile, business property, and jewelry. And there are a whole host more. It's more complicated than that. So let's look at long-term care insurance. In California, there are 3 forms covering you in 2 locations. So nursing facility, including residential care facilities for the elderly, that can have coverage from a long-term care insurance policy designed to cover you in those instances. That's very expensive. We know that nursing home stays can be very expensive. But more and more folks are using long-term care insurance at home or staying home longer. So there is coverage for home care. And then comprehensive is really long-term care insurance in either situation, wrapped up in one policy. So some basics, the plans will pay a selected daily amount. So this is all lined out in the contract. They'll pay maybe $100 a day or $200 a day in a nursing facility, or home care is maybe $35 a day. So again, it's all spelled out in the policy. As you have picked policies, or if you're looking at policies, there's what's called an elimination period. It's just a fancy name for saying a waiting period. And a waiting period can be time-based, so once you need activities of daily living, then maybe it takes a month before the policy can kick in and cover you, or that you can submit a claim. Or maybe it's an amount of money that must be paid before the plan kicks in that goes toward long-term care services. So policies will vary on what triggers the elimination period and what satisfies the elimination period before you can submit claims and start getting money back. Plans also have limits on how many years it will pay for benefits. Unlimited is, of course, probably the priciest, because there's no closing, there's no limit on the years of the benefits. Some are unlimited, some have 5 years, 3 years, 2 years of coverage. Other features you can buy if it's not included. So something called inflation protection. And the general rule of thumb is you want inflation protection. Don't go without that, especially if you're starting off, because we know that home care prices and skilled nursing facility care it increases every year. So there are different types of inflation protection, 5%, compounded 3%. There's also a feature called waiver of premium, which means that once you've initiated a claim, once a claim has been triggered, and you're now within or past your elimination period, you won't pay premiums anymore, and you can just start receiving the benefits. It's called the waiver of premium. There's also a non-forfeiture benefit. Now, this is just a term for what happens if you can't pay your premiums. We're hearing a lot of premium increases. There are different ways to negotiate. You always have the right to negotiate if you can't pay your premium. Maybe you can pull back on some benefits, change from unlimited to 5 years or 3 years. That might freeze your premium, or maybe you get a lump sum back of all the premiums you paid. We don't necessarily recommend that, but there are different options for that situation. Or you just don't give up any benefits. You get somehow you negotiate your premiums, and you still keep the benefit even if you've stopped paying, but maybe decreased in that situation, of course. A forgetfulness feature. If you forget to pay your premium, you're still protected in some way, as long as you pay the back premiums. And that just points to the fact that a lot of these long-term care policies are written years. You get these years in advance and sort of put away, and it's usually not you who is interacting at that point with the insurance company, but rather, the able spouse or the children. So, keep that in mind. You want to leave things for those folks in an organized and understandable fashion. So the biggest thing when you're using these is like, how do I file a claim? When can I do it? The people who are going to be helping you may not understand it. So you need the documentation. Always keep it in a safe and secure place that they can then look at the policy, because all the details are in the contract. There's something called a California Long-Term Care Partnership. And these were set up to sort of work with Medi-Cal on the back end. So there are two types of policies again: nursing home, including RCFEs, residential care facilities for the elderly, and comprehensive. So it includes care at home. They're standardized. They provide lifetime poverty protection, and higher consumer protections exist with greater consumer flexibility. I can provide some links as to these, but the way it works is it protects your assets dollar for dollar. I'll show you an example in a second, but as a general rule, it's easier to find a bed in a nursing home, starting off as a paying client versus going in as a Medi-Cal beneficiary. So if you, this is the link, areyoureadyca.org, that talks about and goes into greater detail about California partnerships for long-term care. So here's what it looks like. Let's say a single person has 110,000 in savings. And again, the key word here is single person. This person would not qualify for Medi-Cal because normally you have to have less than $2,000 in savings. But let's say this person purchased a California partnership policy with a $100,000 benefit, lifetime benefit. Okay, so that's the policy coverage. Then this person goes into a nursing home, and after a year, it costs $100,000. And so the policy's been used up. Okay, $100,000 has been paid by the policy, but meanwhile, this person has the $110,000 in savings. Well, because of the California partnership, $102,000 is protected of that 110. How do we get to that? So because of the policy, $100,000 is protected. Furthermore, the $2,000 of, that $2,000 limit, so the person can keep $2,000 in the bank. That's $102,000 protected due to this partnership. So 110 minus 102, this client has $8,000 unprotected. So in other words, this person would have to spend that $8,000 down before Medi-Cal starts paying its portion of the nursing costs. Okay, so that's typically how California partnership works for a single person. So they keep $102,000 in the bank for other costs. Now this is a hard one to answer. Is long-term care right for you? So some general guidelines, and I've left these in just more as discussion than anything. Premiums the lesser of 7% of your gross or 50% of your discretionary funds. Plan for lower income and higher premiums with time. So that's definitely what we're seeing. Premiums have increased quite a bit. Assets. So buy coverage equal to your assets. If you have lower, Medi-Cal is probably in the picture with lower assets. Self-insured with higher assets. The optimum age is 55. Higher than that, premiums increase. Sometimes plans will sell you depending on your health situation at higher ages as well too. This is a very old report. I left it in. Maybe I shouldn't have, but at a time, there were statements that said, consider self-insuring with 320,000. I think we can all agree that that number, you'd have to be in a really low cost area for that to make sense. It probably doesn't make sense anymore. So you can see, and this slide I just kept in because let me change to my headset. I hope this works here. 1 second. Okay, can you hear me still?
Yep, sounds good.
Okay, good. You can, this is debatable. Some would say over 1 million at this point, but it really depends on your situation. I don't think you can just put a hard and fast number on it. But in this area, that may not be true. But you want to look for flexibility, compound inflation if possible. If you don't have support, then you may consider skipping the home care, which makes sense. Keep it to a 4-year coverage max based on some earlier statistics. That may be over coverage, but certainly start talking to folks who could help parse this out. Wall Street Journal says calculate the minimum policy you need by only the amount you cannot pay by yourself. Their suggestion is limited to 5 years, and watch out for these increases. Again, think about the family and talking to your family about this, getting them on board. There is a good document called Taking Care of Tomorrow. So if you type that in, Taking Care of Tomorrow, it's put out by the California Department of Aging, CDA. And it helps you understand the terms of long-term care insurance more than anything, along with the other resources that may be available to you. So what it looks like is, let me just show you. So it's this booklet, Taking Care of Tomorrow, A Consumer's Guide to Long-Term Care. So if you do a Control F on this PDF and say elimination, you'll see some definitions of what an elimination period is, or other features of your long-term care insurance plan. That will help demystify the plans that you have. And again, I've worked with some clients who are struggling with filing claims with their long-term care insurance plans, and that's the actual contracts vary, and getting familiar with the terms will help you or those who are trying to help you.
reducing the need is probably of course, we're always trying to do that. Nutrition, we're learning affects, it helps us with our longevity and our health in the long run. I've heard different speakers from USC and San Diego who study dementia, and their recommendation is dancing is one of the best things, because it activates your mind. And you're making a lot of your decisions in response to a live partner. So that and board games and so forth help a lot. And then, of course, remaining active. So volunteering. If you have a knack for Medicare, I will be the first to ask you to help us. We're always looking to improve our volunteers, especially those who have other skills, whether it's language or experience with Medi-Cal, Social Security, or just enjoy solving and analyzing different situations and puzzles. So, but there are plenty of volunteer activities out there that can help you. So again, take care of yourself physically, mentally. Look at these, talk to people in the know, especially with your families, and making advanced directives where possible. So with that, I'll just wrap it up and take any questions that folks may have.
All right. Well, thank you for informing us about something as important as long-term care. I mean, we know it's a difficult topic, but I think it is important to discuss it with family members and folks that are in the know. So thanks for unpacking some of that information for us, Marcelo. We do have a few questions in the chat.
Okay.
Oh, and by the way, before we get to the questions, so the slide deck that Marcelo has been going through with us, we did send it on over the other day, and all of the links that Marcelo was referencing within that slide deck that we all saw will be live links in the file that y'all get. But I did post some relevant ones also in the chat. And okay, so the first question is, are IRAs, quote, pensions you can cash? And that was earlier, Marcelo, about 20 minutes or so ago.
Yeah, when it comes to Medi-Cal, so the way it's been explained to me is that these retirement accounts count as resources and assets, and until, however, you start taking minimum required distributions, at which point it's no longer considered an asset or resources against you, but what the distribution is counts towards income. So I hope that clears it up.
Is that also true for 401ks?
Yes. Okay.
And there was another one, and I can't remember the context to this. I apologize, Renee. This one was, what does flexibility mean? Perhaps that may ring a bell to you, Marcelo. I'm sorry.
Yeah, no,
but
let me go
It was
back.
the first bullet on the long-term care, selecting a long-term care policy, and the first bullet was flexibility.
Oh, yes. Okay. So let me try to find that. Some policies that are pretty well defined in terms of where the coverage can be had. Some policies have stricter definitions of the what home might mean, but I guess that's there's also I'm trying to jog my memory with that. Other aspects of a policy with respect to the elimination periods and what can trigger elimination periods. Some are more strict than others. And also where you can get, where you can, who will pay. So there are many different features in policies, and I think that's what I was trying to get at.
Thank you, Marcelo. There's another good one here, which I hadn't quite heard of, but I just briefly looked it up. So one question is, some say mandatory long-term care insurance in Washington is coming to California. Do you know if that may be true, and when and what satisfies it? So apparently I just looked online, and the state of Washington, and you may know this already,
Yeah,
as of April 1, there's a new tax that those residents apparently have to pay into some of that coverage.
yeah. Yeah, I don't know if it's coming to California. We're in the middle of a master plan on aging. California's, I think finally recognizing this huge need. But I can't tell you. I wish I could if that were coming to California or not. Usually California is at the forefront of these things, but seeing Washington do that, it provides possibly a nice target for retirement. I mean, that's a huge benefit. To me, it's nice to see. Again, I just don't know. I know there are probably a lot of discussions around that, but I don't. Yeah. Maybe I'll just go down the list here after that, Stephen. So Larry's asking, what are some of the issues with filing claims with long-term care insurance? Seems that there can be a lot of entanglements. In my personal experience, some have been really easy to deal with. Some make it a little difficult. Everything in writing, I would say, and getting to the right person, faxing the right documents, getting the right documentation of long-term care. So some long-term care plans require nurses' logs and will coordinate with the home health care agency. Typically, they don't pay for family members to provide the care at all. Rarely has there been an exception, but they're typically receiving information from the company that's providing the long-term care. So establishing the need for ADLs, activities of daily living, are what trigger the start of an elimination period. It depends on the plan. Maybe you need 3 ADLs or 4 ADLs. But a lot of it is just in the communication and documentation. Without meeting those, then there's sometimes a lot of delays. So is there a ballpark figure when you should seek long-term care based on current net worth, factoring inflation? Hang on, I'm gonna move real quick.
I've seen numbers all across the board, and I think there are folks who argue that there is no one number. I mean, there's probably a right number for each person. There are various. I don't have a single calculator or site that I could refer you to, unfortunately. But I know there are just a lot of different factors involved in figuring out if you should self-insure or not. Okay, does enrolling in a new Part D plan automatically unenroll you in your previous Part D plan? Yes. So the rule is you can only be in one Part D plan at a time. So by enrolling, it will drop you from the Part C plan, in fact, because it's tied to D plan, or the other standalone drug plan. Another question, when we need long-term care, we probably are weak and sick and need help to get all this paperwork done, yes. Who will help them if you don't have family? Right, so that is such a good question. If there's just nobody, there are different social workers that can be had at different locations, but you'll still need to have paperwork signed by somebody who can represent you. So those are important documents, authorized representative documents. And if one can't make decisions on one's own, then there's conservatorship in some cases where the state steps in and makes decision. So yeah, that is something that needs to be thought about. Okay, so let's see. I think I've covered all the questions. So, all right. If there are any more people want to just chime in, certainly open it up for that.
Yeah, that was great, Marcelo. So, thanks again for unpacking all of this material. Let's see, we started our journey a little after 9 o'clock. Just giving an overview of Medicare. We talked about the original parts of Medicare being A and B, and what those cover, some of the premiums, some of the enrollment timeframes. We also discussed when folks do opt for the original or traditional or even fee-for-service Medicare route, they oftentimes pick up a Medigap or supplemental plan to help with some of those out-of-pocket costs. We're almost fully covered until we pick up a Part D standalone prescription drug plan and all the options we have. And then you also went over the second route that we can all handle our Medicare through, which is the Medicare Advantage route. Here in Santa Clara County, almost every single one of them include our Part D prescription medications. You also went over some of the extra benefits that some of those Medicare Advantage plans cover. And also rewinding back to original Medicare and the Medigaps, there were about, somebody asked, what are some of the extra benefits that the Medigap plans are starting to offer? And we noticed some of the Medigap plans offering these extra benefits in 2020. I noticed there were 3 companies that were offering them, and they were kind of all over the place. Some were included with an extra cost. Some were included with specific Medigap plan letters, but so that was great. Just an overview of Medicare. Then you went over the Part D plan finder, and I'll take this time to, please, everybody here, take the opportunity during the annual enrollment period, which is October 15 through December 7. Review the plans that you have. You might be able to save yourself a lot of money. I know our high cap office is highly active and busy during the annual enrollment period. As a matter of fact, we are doing a bunch of annual enrollment period presentations, just like kind of what you saw now. We're going to let y'all know the updates for next year, let you know some of the changes and why you may want to take action. So feel free to join some of those sessions. You can reach out to us or check out mysourcewise.com. And also we went into long-term care, but yeah, now's a good time to open it up for any final questions. Thank you. All right.
Well, thank you, Marcello. Thank you, Stephen. I think that was a terrific coverage of particularly the long-term care, a very complex and difficult subject. But I appreciate your help. And I will mention again, I've used SourceWise resources for myself and recommend them for others. And the feedback has been very positive. So we appreciate that. A reminder to everybody, if you want to save the chat, on the bottom of your chat window, there are 3 dots right next to the smiley face, just to the left. You click on that, click save, and it'll save on your local computer a copy of everything that's on chat. So thank you very much. It's good to go over this stuff. And I'll just make a comment that for those of you who participate in our financial planning special interest group meetings, some of these, these subjects are covered there. And so if you want to tune into the meetings that apply to your interest, you can, that's 9 or 10 sessions where we spend 2 hours doing a presentation and answering questions on some of these very subjects. And planning for your retirement and planning for your death is a real gift to the people that are left behind when you're gone. So think about that. And thanks for the emphasis there. So I wish
There's
you guys
one more statement in chat.
Oh.
I don't know if they want to comment on or not. I was told that since I'm on Medicare via SSDI, that I'm not eligible for Medigap due to my younger age. I don't know if there's any alternatives or comments.
Can you hear me okay?
Yes.
Yeah. So in California, you have the same protections. So this is what we call Medicare due to a disability. Typically those under 65 with Medicare. You have the same open enrollment rights to get a Medigap. But if you don't have that open enrollment, if you're not in an open enrollment period or in a guaranteed issue period, then they will not sell you one, even though there's underwriting. Maybe they let you go through the process of answering questions. Once they find out that you have Medicare due to a disability, then they will they'll just not sell you a policy. So you need to find a way to trigger a guaranteed issue right, if that's possible. So one strategy is, if you're really in need, is to join a Medicare Advantage plan, at least for the meantime. And it's not a guarantee, but as I mentioned earlier, if a Medicare Advantage plan increases copays or drops benefits, it does trigger a chance to get a Medigap. That's sort of a long range gamble, but it's a possibility. Or moving out of a Medicare Advantage area, at least in California, can trigger a Medigap. People with end-stage renal disease, kidney failure, under 65, they just cannot get a Medigap here in California. Other states maybe, but not in California. I hope that helps. But feel free to come and talk to us if you need some guidance. Another question: is it more economical to get traditional long-term or only hybrid only, or is there more fee incorporated in the plan to split the funds between traditional and hybrid plan? I think you're talking about a nursing facility benefit or home care, long-term care benefit, or a combination of both. So it depends how the plan's written. But typically you can use, if you have your maximum benefit amount can be split and tapped by in either situation. So of course, if you have a high benefit amount, it will last longer if you're just using it for home care. Again, it's all managing risk and what you anticipate. So hybrid or comprehensive long-term care plans would be more expensive. than just home care, long-term care benefit. But yeah, you can tap into the funds for both. But again, it still comes down to the contract.
No, I can you hear me?
Yes, hi.
Yeah, what I mean is there's two ways. One is the long-term care, where traditional long-term care you pay monthly. It's a very inexpensive long-term care versus the hybrid that there's like you pay. It's sort of like an annuity that you pay a certain amount in or certain that I think it has something to do with insurance. So I was wondering, I was thinking of getting both, split the money and get both versus getting one or the other, because I'm fear that long-term care with traditional way they're gonna increase along the way, and I have a long ways to go, so I thought maybe I'll split the funds into both, so at least I have coverage for both. But I was wondering if that's going to cost me more in a sense that I'm buying different ones versus just going into one or the other.
Yeah, I mean it's trying to decide between these different products now that long-term care is being included in these other insurance products. I can't speak to those other products. Of course, if you're in two products, you're paying two premiums, but you'll have more risk covered perhaps. And depending on your needs, it may be useful, but I don't think I'm in a position to say about the other products.
Also, you mentioned something about the 100,000 regarding long-term care, and I stepped away. I did not hear it. You mentioned something about. I don't. Can you go over just briefly on that?
Oh, I was talking about the type of long-term care policy that's available in California. It's called the California Partnership, and it was in that context that I was talking about the $100,000 example. It actually, where somebody has a California partnership and is trying to protect their assets. So a California partnership plan protects dollar for dollar a person's assets. So if someone takes out a California partnership policy that has a benefit of $100,000, it will protect the person's assets of the same amount before they, which is useful for triggering Medi-Cal down the line. So that was the context in which I mentioned that $100,000. And I can please put that that link in there. So it's actually areyoureadyca.gov. areyoureadyca.org to learn more about that. So I just put. Okay, I think that's about it for the questions. Thanks, Stephen.
Okay, thank you very much.
Okay.
For your time and energy and the difficulty of the subject and the fact that we were able to answer a lot of questions, which is one of the things I really like about the presentations you do is you answer people's questions. So I wish you guys a good day. And unless there's any other question that anybody has, we'll bring this to a close. And everybody take care and stay safe.
All right. Thank you so much.
All right, bye, everybody. Enjoy the rest of the weekend.